Hello friends, today we are going to discuss what is hypothyroidism. There is a very beautiful joke. Anger is uneasiness or discomposure of the mind upon the receipt of any injury with the present purpose of revenge. John Locke. Thyroid gland is in the front of our neck. This is the part of the neck, and this is Adam's apple, and below that this is a butterfly type thyroid gland. This is isthmus, and these are two parts, right and left. So this is this is brain. Brain produces a hormone called TSH, thyroid stimulating hormone, and this stimulates the thyroid gland. You must know that to produce TSH, we require these four elements. If these elements are not present in our body, we will not get this TSH. What are those? Protein, magnesium, B12, and zinc. These, these are essential for TSH production, and it affects on the thyroid gland. And thyroid produces two types of, rather main two types of hormones. One is T3, which is only 15% and is active. And the other is T4, which is 85% and it is inactive. It is rather a stored hormone. And on requirement, our liver interchange T3 and T4 with the help of selenium. So it is very important that we must get adequate T3, which has got a very positive effects on the cells to metabolize them, and all the actions of T3 is on the cells. This is that. And on the other hand, T4 is inactive and it requires iodine, vitamin C, and B2 to produce these T3 and T4. These three elements must be present to give us these T3 and T4. When we normally, what we do, we give T4 as a medicine to the patients of hypothyroidism. And when it is not converting to T3 adequately because selenium is not present, then there is excess of T4. When there is excess of T4, it makes RT3, reverse T3. Reverse T3 is a isomer of T3, and it is inactive. And when T4 is more, T4 is inactive, and RT3 is still inactive. It can't stimulate the cells. It blocks the function of cells. So there is hardly any use of giving those medicines if the conversion is not taking place. So to get into the cells, T3 getting into the cells require vitamin D3 and vitamin A. it is also important. If it is not present, there may be adequate T3, but your cells will not function properly. So vitamin D3 and vitamin A are also required to get this T3 actions on the cells. So this was a nutshell preliminary knowledge about the elements required. So next is, what is goiter? Goiter is an enlargement of your thyroid gland. That's the gland at the front of your neck, as I have shown you, just below your Adam's apple. It may be a temporary problem that will get better without treatment, or it can be a symptom of another possible serious thyroid condition that requires medical attention. Types of goiter. Since many things can make your thyroid swell, there are lots of types of goiters. A few of them are simple goiters, which happen when your thyroid gland doesn't make enough hormones. The thyroid grows larger to make up for this. Endemic goiters, sometimes called colloid goiters. These are caused by lack of iodine in your diet. Your thyroid uses iodine to make its hormones. Few people get this kind of goiter in countries where iodine is added to table salt, like the United States. Sporadic or non-toxic goiters, which usually have no known cause. Certain drugs and medical conditions can trigger them. Multinodular goiters, which happen when lumps called nodules grow in your thyroid. What is hypothyroidism? Hypothyroidism is also called underactive thyroid disease, is a common disorder. With hypothyroidism, your thyroid gland doesn't make enough thyroid hormone. The thyroid gland is located in the front lower part of your neck, as I have shown you. Hormones released by the gland travel through your bloodstream and affect nearly every part of your body cell, from your heart and brain to your muscles and skin. The thyroid controls how your body's cells use energy from food, a process called metabolism. Among other things, your metabolism affects your body's temperature, your heartbeat, and how well you burn calories. If you don't have enough thyroid hormones, your body processes slows down. That means your body makes less energy and your metabolism becomes sluggish. Symptoms of hypothyroidism. There are hundreds of symptoms of hypothyroidism, but few of them are vague and can often mimic other conditions, and they may include changes in the menstrual cycle, constipation, depression, dry hair and hair loss, dry skin, elevated cholesterol, fatigue, greater sensitivity to cold, hoarse voice, joint pain, stiffness and swelling, problems with memory, muscle aches and stiffness, muscle weakness, puffy face, slow heart rate, swelling of the thyroid gland called goiter, I have shown you, unexplained weight gain or difficulty losing weight, carpal tunnel syndrome. Causes of hypothyroidism. The most common cause of hypothyroidism is Hashimoto's thyroiditis. Thyroiditis is an inflammation of the thyroid gland. Hashimoto's thyroiditis is an autoimmune disorder. With Hashimoto's, your body produces antibodies that attack and destroy the thyroid gland. Thyroiditis may also be caused by a viral infection. Other causes of hypothyroidism include radiation therapy to the neck area. Treating certain cancers such as lymphoma requires radiation to the neck. Radiation damages the cells in the thyroid. This makes it more difficult for the gland to produce hormones. Radioactive iodine treatment. This treatment is commonly prescribed to people who have an overactive thyroid gland. a condition known as hyperthyroidism. However, radiation destroys the cells in the thyroid gland. This usually leads to hypothyroidism. Use of certain medications. Certain medicines to treat heart problems, psychiatric conditions, and cancer can sometimes affect the production of thyroid hormone. These include amiodarone, cardarone, pasirone, interferon alpha, and interleukin 2. Thyroid surgery. Surgery to remove the thyroid will lead to hypothyroidism. If only part of the thyroid is removed, the remaining gland may still be able to produce enough hormone for the body's needs. Too little iodine in the diet. The thyroid needs iodine to produce thyroid hormone. Your body doesn't make iodine, so you need to get it through your diet. Iodized table salt is rich in iodine. Other food sources of iodine include shellfish, saltwater fish, eggs, dairy products, and seaweed. Iodine deficiency is rare in the United States. Pregnancy. The reason it isn't clear, but sometimes inflammation of the thyroid occurs after pregnancy. This is called postpartum thyroiditis. Women with this condition usually have a severe increase in thyroid hormone levels, followed by a sharp drop in thyroid hormone production. Most women with postpartum thyroiditis will regain their normal thyroid function. Problems with the thyroid at birth. Some babies may be born with a thyroid gland that did not develop correctly or does not work properly. This type of hypothyroidism is called congenital hypothyroidism. Most hospitals in the US screen babies at birth for this disease. Pituitary gland damage or disorder. Rarely, a problem with the pituitary gland can interfere with the production of thyroid hormone. The pituitary gland makes a hormone called thyroid stimulating hormone, TSH, which tells your thyroid how much hormone it should make and release. Disorder of the hypothalamus. An extremely rare form of hypothyroidism can occur if the hypothalamus in the brain does not produce enough of a hormone called TRH. TRH is thyroid reproducing hormone, affects the release of TSH from the pituitary gland. Primary hypothyroidism is caused by a problem with the thyroid gland itself. Hypothyroidism in children. Children and teens may also have hypothyroidism with the signs and symptoms seen in adults. Kids and teens may also have delays in puberty, delays in growth and shorter stature, slow mental development, slower development of permanent teeth. Hypothyroidism risk factors. Women, particularly old women, are more likely to develop hypothyroidism than men. You are also more likely to develop hypothyroidism if you have a close family member with an autoimmune disease. Other risk factors include race, being white or Asian, age, growing older, prematurely graying hair, autoimmune disorders such as type 1 diabetes, multiple sclerosis, rheumatoid arthritis, celiac disease, Addison's disease, pernicious anemia, or vitiligo, bipolar disorder, or Down syndrome, or Turner syndrome. Complications of hypothyroidism. Untreated hypothyroidism may cause complications such as balance problems. Older women are at extra risk for balance problems if their thyroid hormone levels are too low. Goiter. If your thyroid is always trying to produce more hormones, the gland can swell and change the appearance of your neck. You may also have trouble swallowing, heart problems. Hypothyroidism puts you at greater risk for heart disease and can raise your levels of LDL or bad cholesterol. Infertility. Too little thyroid hormone may disrupt your production of eggs, ovulation, and make it harder to conceive. Joint pain. Low levels of thyroid hormone can cause you to have aches and pains in your joints and muscles, as well as tendinitis. Mental health issues. Low thyroid hormones can cause memory or concentration lapses, as well as decreased interest in activities you used to enjoy. See your doctor if you notice these changes, as they could also be due to depression unrelated to your thyroid. Obesity. Although hypothyroidism may curb your appetite, you can gain weight because your metabolism slows down too and you don't burn enough calories. Peripheral neuropathy. Over time, low thyroid hormones can damage your peripheral nerves. You may notice pain, tingling, or numbness in your limbs. Thyroid problems in a pregnant woman can affect the developing baby. During the first 3 months of pregnancy, the baby receives all thyroid hormone from its mother. If the mother has hypothyroidism, the baby doesn't get enough thyroid hormone. This can lead to problems with mental development. Extremely low levels of thyroid hormone can cause a life-threatening condition called myxedema. Myxedema is the most severe form of hypothyroidism. A person with myxedema can lose consciousness or go to a coma. The condition can also cause the body temperature to drop very low, which can cause death. Investigations. TSH is a brain hormone, not a thyroid hormone, and yet traditional medicine relies on this one test for the clinical diagnosis and management of thyroid disorders. With a reference range as wide and as deep as the Pacific Ocean, the devastating result is a multitude of sick people declared perfectly normal with symptoms all in their head. Solution is the network of doctors uses a comprehensive diagnostic approach, including advanced blood, urine, saliva, and genetic lab analysis, in-depth medical history and symptom evaluation, and computerized measurement of resting, metabolic rate, and deep tendon reflexes. A classic sign of hypothyroidism is delayed relaxation of deep tendon reflexes known as Voltman's sign. Optimal values. TSH is 0.5 international unit per milliliter to 4.5 international unit per milliliter is normal, but the optimal level is 0.5 international unit per ml to 1.5 international unit per ml. Free T4 0.8 nanogram per deciliter to 2.8 nanogram per deciliter, but the optimal value is 1.3 nanogram per deciliter to 2.8 nanogram per deciliter. Free T3 2.3 picogram per ml to 4.2 picogram per ml. The optimal is 3.7 picogram per ml to 4.2 picogram per ml. The red ones are the optimal levels of values, optimal values of these hormones. Thyroid autoimmunity is rampant. Problem is thyroid autoimmunity is more than a thyroid problem. The immune system is designed to defend against harmful invaders, but that immune system may mistakenly attack your own body parts. Like wildfire, that attack may spread from your thyroid, Hashimoto's to your gut, celiac disease to your joints, rheumatoid arthritis to your nerves, multiple sclerosis to your pancreas, diabetes, The tragedy is that thyroid antibodies are rarely tested because traditional medicine has little to offer to directly address them. Solution is the doctors have a high success rate of putting thyroid autoimmunity into remission and halting the autoimmune tech cascade with protocols developed through rigorous clinical trials. Lab tests. All these comprehensive lab tests are done. TSH, free T3 and T4, reverse T3, thyroid antibodies, anti-TPO, TG antibodies, TSI for Graves, 4 iron labs, ferritin, percent saturation, TIBC, serum iron, adrenal cortisol levels in saliva, not in blood, B12 and folate, magnesium, potassium, calcium, sodium and glucose, vitamin D3, sex hormones, progesterone and estrogen and testosterone. All these lab tests give the comprehensive view of your thyroid gland. Comprehensive treatment plan is also with protein, adequate protein, magnesium, B12, zinc, iodine, vitamin C, vitamin B2, selenium, vitamin D, and vitamin A. All these are required for a good thyroid gland. If we give all these preliminary requirement of a thyroid gland, we can get over to the hypothyroidism in a nice and adequate way. Thank you very much.